This segment is sponsored by AMCP. Healthcare is always a hot topic, and companies are constantly launching new products for patients, and elected officials use it as a platform for policy. But do you know what managed care pharmacists can do for you? Here to tell us is Susan Cantrell, CEO of the Academy of Managed Care Pharmacy. Welcome. Thank you so much for being here.
Thank you for having me.
Of course, yes, healthcare, it is always in the news. There's a lot going on. And for patients, it can be a little bit confusing. So if you could, tell us a little bit more about your organization and the role of your members.
Sure, happy to. So AMCP is an organization of individual members, pharmacists, and other healthcare professionals that work together to develop and implement pharmacy benefits and also manage population health for the populations that they serve. So our members support patients that are covered by various types of plans, government plans, Medicare, Medicaid, the marketplace, also employer-sponsored plans and others. And what they do is work to analyze clinical evidence and other parameters, seeking to determine the safest and most effective therapies for the patients they serve. They also negotiate discounted prices with pharmaceutical manufacturers, and on the employer side of things, they design the benefits that the employers have asked them to develop for the patients that they serve. So they work together to manage pharmacy benefits, and at the end of the day, our overarching goal is to make sure that patients have access to safe and affordable medicines and other therapies.
And Susan, how does AMCP work with its members to improve health for people?
So we like to think of one of our superpowers as being conveners. And what I mean by that is we bring together the key experts in different areas, payers, pharmaceutical manufacturers, and of course, most importantly, patients, patient advocacy organizations, to really talk about some of these challenging issues, but not just talk about it, devise solutions. And maybe the best way to illustrate it is to give you an example. So the Pre-Approval Information Exchange Act was passed by Congress in December of 2022. And how that came about was our members came to us and said, we have challenges getting the information that we need about these very innovative products before they come to market. And what results is that there's a delay. We need time to evaluate these and figure out their place in therapy and how we'll get those to the patients that we serve. So we need to speed up the process. So what we did is, working with these key stakeholder groups, devised a process called Pre-Approval Information Exchange, developed legislative language, worked with Congress to bring that forward, and thankfully it was passed in 2022. So the result of that is that we've sped up the process for getting innovative therapies to patients.
What are some of the most pressing issues that patients are facing and managed care pharmacies right now?
So over the last decade, we've seen huge growth in an area that we call specialty pharmaceuticals. So these are medications that are used for complex and often very serious conditions. I mentioned cell and gene therapies, that's a sector of this. And again, prices are expensive, and we only have finite resources to pay for healthcare in this country. It's becoming increasingly important. Almost 20% of our gross domestic product is spent on healthcare. So we need this group of individuals that are highly skilled, trained, clinical experts on medication use to really say, how do we best steward those healthcare resources? So that's the work our members do.
Yeah. I understand you have a big event coming up. Tell us about that.
Sure, yes, we're really looking forward to it. We expect to bring together hundreds of policy-minded healthcare professionals in National Harbor later this month for a Pharmacy Policy Summit. Really looking forward to that. It's the day before our annual Nexus Conference, and that's a 3-day event where we provide education on all of these pressing issues. But I would say the most important thing that we're looking to do there is bring all these people together, the stakeholders that have expertise in the various areas, the most important of which would be patients and patient advocacy organizations. Bring them to the table to talk about these significant challenges that we have in healthcare in America, and also come up with solutions that we can propose and bring forward.
Yeah. Thank you so much for sharing and walking us through all of this. We really appreciate you being here.
Thank you.
Yes, of course. For all this information and more, you can head to amcp.org.